Call Calcagno and Rossi Vein Treatment Center for a free screening.
Summer is just about over, but it doesn't mean your legs can't still look and feel their best. Vein expert Dr. David Calcagno of Calcagno and Rossi Vein Treatment Center is here with some frequently asked questions on getting rid of ugly and sometimes painful varicose veins. So we're asking the vein expert today. Let's get right to the questions. Susan from Mechanicsburg has a question. You said it's very timely considering my situation right now, but she said, my mom and I both have big varicose veins. She blames me since hers started when she was pregnant with me. I blame her for giving me her varicose veins. Who's right?
Well, that's actually an interesting debate I hear a lot when mothers and daughters come together for their appointments at the vein center. And first of all, no one's to blame, but you're both right in that hormones of pregnancy and being pregnant as well as heredity are the two main risk factors for developing varicose veins. So it's a tie.
Yeah, so maybe the mom even already had that kind of disposition to have them, and then once getting pregnant, that kind of, we've talked about that before on the show, kind of sparks that. Tom in Camp Hill, he has a good question. He says he has both those bulging varicose veins as well as spider veins, and he's wondering if his insurance company would pay for the treatment of the spider veins, or do they only cover the treatment for those big varicose veins?
Generally, insurance companies cover vein disease if the vein disease is associated with symptoms. Those symptoms can be tiredness, heaviness, aching, itching, throbbing. Even muscle cramps and restless leg syndrome can be caused by vein disease. Although insurance companies don't cover the direct treatment of the very small spider veins, sometimes the presence of spider veins can be an indication that there is an underlying vein problem, which would be covered.
Okay, and he even says he has that bigger problem, those big bulging ones. I thought this was a really good question when I saw it. Krista in Dillsburg, she wants to know, why do varicose veins occur in the legs but not in the arms? I really want to know this answer.
That's, do we have that diagram?
Yeah, we do. Yeah, we'll put that up on the screen.
Veins have valves, as you can see from this middle of the three pictures. A normal vein with normal valves allows blood to go only one way, and that is back to the heart. On the picture to the right, if the valves are damaged or diseased, the blood can actually go backwards.
Ew.
The veins in the legs are more predisposed to having these valve problems, and since the legs are so much lower than the heart when you're sitting or standing, the back pressure can be quite high.
That makes sense.
Arm veins are less prone to having valve problems and are much closer to the level of the heart, so you wouldn't get such high back pressure.
Yeah, that does make sense. Poor Deborah, she has a good question. She's from Walnut Bottom. She actually said she had the vein stripping surgery in the hospital 25 years ago, but the bulging varicose veins, they're back, and she wants to know if there's anything more that can be done, or is she going to have to go through that same big procedure again?
Well, she would not have to undergo another vein stripping. Vein stripping was an operation that we did historically until recently, where the saphenous or main surface veins of the legs were actually removed in the hospital under general anesthesia, like Deborah described. Nowadays, if there is any remaining underlying vein valve problems, they can be treated with just simply catheter ablation techniques in the vein center under local anesthesia. If all the underlying veins have been removed from her time 25 years ago, and she just has the bulgy veins, they can also be treated just under local anesthesia at the vein center.
That's good.
So she's not looking at another vein stripping.
Some of the procedures that we featured on the show before, I mean, it is really amazing. It's almost instantaneous, some of the treatments that you do. If folks maybe in the audience, they have some questions, I know they can submit them to you. They also can come to a vein screening, and you have 2 of those next week?
Yes, next Tuesday and Wednesday. If anyone has any of these questions, feel free to come by, call for an appointment, and we'll take a look at things and give you some advice.
Very good, and there's lots of different treatment options, so I'm sure you can pinpoint the right one for each patient. Good to have you back on the show with us,
You too,
sir.
and congratulations.
Thank you.
Call Calcagno and Rossi Vein Treatment Center for a free screening.